Hi, in this video, I'm going to be talking about nipple reconstruction surgery. We've talked about breast reconstruction in previous videos. This time I'm going to focus specifically on nipple reconstruction. After having removal of the breast, or if you keep the breast but the nipples removed as part of your surgery, you may wish to have your nipples reconstructed. And there are several ways this can be done. I'll talk first about constructing the nipple, and then I'll talk about tattooing. So you may wonder, why would I want to have my nipple reconstructed? I'm perfectly happy. I don't want any more surgeries. Well, one thing I've learned is that after a nipple is reconstructed, it's very common for people to see fewer or less pronounced their incisions on their breast. And that's because the eye now goes to the nipple. So the scars of the incision, whether it's on above and below the breast or across the breast, become less prominent because the eye can go to the nipple. I hope that makes sense. So that's one reason that people do it. Some people also want to have as normal looking a breast as possible. I wish that nipple reconstruction could restore sensation to the nipple. It does not. The fact that there is no sensation or minimal sensation in that area means that reconstruction is relatively painless because you don't have the nerves that would feel the effects of any additional surgery. So when a nipple is reconstructed, we often use the tissue of the breast itself. The tissue's pulled up and then kept erect and kept taut. So that creates a raised nipple. It's also possible that we can use tissue from another part of the body and graft it onto the reconstructed breast or your intact breast that no longer has the nipple. So we can use both your own skin from the breast itself or a graft from elsewhere. A grafting procedure will take longer. Using the nipple itself and just raising part of the breast can take as little as 15 minutes. After the nipple is constructed, you will have usually a nipple shield put over the nipple with usually an antibiotic cream that will help protect this area of your breast or breasts during healing. Now I'm going to talk about tattooing. The areola, the brown or pink or darker brown color around the nipple itself, can be tattooed. And that will help the nipple appear as normal as possible. Your nipple reconstruction will allow you to have a breast that appears normal, both with and without your clothes. Over time, a reconstructed nipple can flatten. It's not uncommon for people to have that procedure done again years later. Again, while you may have a little more sensation than you did before, this is generally a well-tolerated procedure. My patients have told me that it's nothing compared to the other surgeries that they've had. It's also possible that the tattooing can fade over time as well. You may wonder, why would I want to do this if I don't have to wear a bra with my reconstructed breasts? And I agree with you. Plenty of people decide not to get their nipple reconstructed because now they don't need to worry about their nipples showing through their clothes. So it's really up to you. I hope this has been helpful. If it has, click like and subscribe. Drop a comment below about your own experience if you're willing to share with the Yerbba community. And you can go to yerbba.com to get your personalized report.